Today we're going to go through the step-by-step instruction for the DUSC demo, a Displaced Uterus Self Check, and hopefully this will clear up any confusion. First of all, you're going to want to fully empty your bladder, as our model has for us already. And then you're going to lay supine, meaning you're going to lay on your back, either on the floor or a nice firm bed. And then you're going to lay with your knees fully bent and your feet flat against the surface that you're laying upon. Next, we're going to start the actual part of locating the uterus, which is a portion of our reproductive system. This is the bladder, so this is why we wanted to empty it, because the uterus lays directly over the bladder, between the bladder and the rectum. And what we want to do is locate the fundus of the uterus for the uterus placement and make sure that it's in the right position for reproductive health and also for proper motility of all the pelvic organs. Then we're going to be locating the ovaries on both sides as well. So again, we're going to be checking the fundus of the uterus and then the ovaries through palpation. This is an external exam that can be done in the comfort of your own home without an internal exam. All right, so for placement, what we're going to do is start anatomically. We're all different, but I'm going to have our model start by putting her thumbs in a triangle shape, forming a base of a triangle at the level of her navel. Perfect. And then underneath her pointer and middle digits, she's going to feel the actual fundus of the uterus, which is very close to the pelvic bone, the pubic rami right there. So we're locating this area. And to do that, we have to understand how much tissue we need to go through. There's a lot of levels. We're going to be first passing through the skin and then past the adipose tissue, which is some of our fat, then through fascia, musculature, and we'll be into the ligaments that actually, the peritoneum that completely surrounds the uterus and ovaries. That's what we're actually touching, is the peritoneum on top of that. So that needs to be at least a sinking of 2.5 to 3 inches. And if you're a little bit heavier, then it would be even more than that to reach those structures. So what you're going to do is take a deep inhale, please. Good. And fully exhale. And as you exhale and your diaphragm moves, you're going to place deeply but gently your pointer and middle fingers down. And you should feel a nice, firm, responsive structure. And that would be the tip or the fundus of the uterus. Do you feel that? Mm-hmm. All right. You can see how deep she is. And that area shouldn't be uncomfortable. Another thing is, if you want to move with your ring fingers on both sides, you can mobilize your uterus, feeling it shift properly side to side, very gently. You don't want a gross manipulation or anything, but just a nice shifting as that organ does constantly move every time our bladder is full and empties and our rectum's full and empties, and as we walk and breathe and swim, all those pressure differentials change where our uterus is. So we want it to be really mobile. Are you feeling it move? Mm-hmm. Great. And you can relax a second. Next structure that we're going to look for is right underneath the pinkies. And I'm just going to have you go on top of the sheet so we can see placement. So we are going to be looking for now the ovaries, which are usually at the level of the pinkies, but they're more posterior. They're deeper in this position than the actual uterus. So this is where you're going to want to feel an almond-like structure close or near or completely underneath the pinkies bilaterally. They might feel tender. One side might be a little bit more enlarged than the other, depending on if you're ovulating from one side more than the other, especially around day 14. And they're usually a little bit more tender, like a testicle would feel to a male. So you might feel a little apprehension or sensitivity, and that's completely normal. So let's do the inhale again, please. Inhale. And exhale fully. Good. And press those pinkies in and see if you can find the almond-like structure of the ovaries on both sides. if you can't feel the uterus and ovaries, that's a huge indicator that the uterus is either shifted laterally one side to the other, or that it's has some torsion in it. There's a kink in a fallopian tube, or the uterus is flipped backwards or moved more backwards or retroflexed. There's a lot of positions the uterus can go in, and then in so doing it pulls the ovaries out of their normal positioning as well. And you can feel them now? Okay, great. Sorry, the sheet was in the way, but again, you're going to want to go really deep for that. So if you want to modify this at all because you feel like you can't find your organ structures appropriately, what you'd want to do is take even more slack out of the abdomen by fully flexing the hips and pelvis. And you can do so by resting your knees on a stack of pillows or laying on the floor and resting your legs upon a bed. That's an easy way of doing that as well. So that is the Displaced Uterus Self Check. We always recommend doing it multiple times because this is unknown territory for a lot of women and their bodies. The more times that you do it, the more awareness you have of the structures that you're feeling, and also your technique improves, and then your accuracy. Again, the more times the better for the Displaced Uterus Self Check.